So my topic of interest has always and always been Mommy Makeover. Hello, I'm Dr. Sheetal Londhe. I'm a board certified plastic surgeon practicing at ZeroSize, Viman Nagar, Pune. In Mommy Makeover, there are number of procedures that have been carried out on a woman to reverse whatever changes have happened because of pregnancy. And so, as the name suggests, Mommy Makeover. In my previous videos, I've explained regarding the breast, the tummy, the types of liposuction, the thigh areas and all. Today, we will work on the small part, which though appears for us just in 1.5 hour surgery, but it's so important for the woman who is undergoing this procedure. And that is the genital rejuvenation. So your pregnancy takes a toll over your body, where the breasts, the tummy, the thighs, the back, everything has been taken a load over, and also the genital area. Nowadays, there are people who come and say, ma'am, we have had a C-section. How does that affect my genitals? But see, the body is preparing for the birth of the baby. From the time of 7 months only, your vagina starts dilating, and so make the path ready for the baby to come out. Even if there has been a C-section where the baby did not come out of the vagina and the pelvic floor had taken its action to get prepared for the baby to come. So yes, the vagina is a little bit lax after pregnancy, not only because of that, but even because of the hormonal issues, or the hormones which are necessary. You can't say them issues, but they are necessary for that body to get prepared for pregnancy and childbirth. So that also leads to vaginal laxity. Other reasons for vaginal laxity is women, they put on weight during pregnancy, and after that they lose weight. When they lose weight, the laxity of vagina again appears. Plus, other reason is also that too much of abdominal girth was increased because of pregnancy, and when it goes back, the vagina becomes lax. So how do we tackle that? Genital rejuvenation is just not tightening the vagina. It's a complete makeover of your needed wonderful parts. So yes, it's the Mons, that is the triangular part, that we will be addressing. It's also the labia majora and the labia minora that should be addressed in genital rejuvenation. And then comes the main part, that's the vagina, and also the perineum, that is the opening of the vagina. So when all these things are addressed in one go, it is called as genital rejuvenation. So now let me take through this one by one to you. So first we start with examining of the patient. What are the complaints that she is telling? That yes ma'am, the vagina is dry, it is lax, I have white discharge, so many things they come out with. Some will just say that ma'am, either it's me who is unsatisfied, it's my partner who is unsatisfied. Someone may say, ma'am, I just don't feel confident when I'm there in that position. So there are many things, questions and answers that the girls have when they come to me regarding the genital rejuvenation. Most of the time they will not even disclose that they need a genital rejuvenation. They just keep on telling about the tummy fat and the thigh fat and all, and just keep on asking the same question. That's when we get to know that yes, they also want to talk about this. And then the question comes, do you want to even talk about vaginal tightening? And then they are like, yes ma'am, I wanted to say it, but couldn't say it because of some hesitation. When I examine the patient, we will decide ki yes, this is what are the problems. We tick them all. Yes, the vagina is lax. It's grade 1, 2, 3, 4, tick. The labia, which is there, the labia minora is supposed to be hypertrophied. Is it asymmetrical? Is there too much of hooding over the clitoris? This is all which we note down. Then comes the labia majora. So usually after pregnancy or after weight loss, these labia majora, they get deflated. And that lovely luscious lip-like feature which is supposed to be there is lost. So we even calculate that yes, the labia majora is deflated. Sometimes it is severely pigmented. That is also noted. Then comes the Mons. Mons, usually because of weight, is been a bit bulky. So when they wear a tight clothes or something, it's been seen through it. So these all points have been noted. When this is all noted, we will explain it to her that yes, you need a monsplasty, you either need a labia majora fat grafting, you need a labia minora reduction, you need a vaginal tightening, that is the vaginoplasty, and then you need a perineoplasty. So all these things when done together is called genital rejuvenation. This is all done in one go. A single anesthesia and everything has been taken care of. But not all women need all these surgeries, right? So it is like an a la carte. Someone comes and she doesn't has a Mons which is hypertrophied or which is bulky or fatty. We don't do a monsplasty. The labia is very normal, so no labiaplasty is required. Even sometimes vagina is having a good thing, but the perineum is so wide open that the female only needs a perineoplasty. So this is how, when we see the patient, only we can decide that what stages or what procedures in the genital rejuvenation is needed for her. And yes, this is just not a procedure, it's a life-changing experience. I have seen girls going from this to this only because of this procedure. So if you have any doubt, you think that yes, I need these genital rejuvenation procedures, or you just want to get yourself evaluated that yes, do I need these genital rejuvenations? Then yes, you can come to us. And to be very honest, it's just not a part of Mommy Makeover. There are many girls who have not got yet pregnant but still have issues with the labia which is hypertrophied and they need labiaplasty. Sometimes for some other reason they have had, perineum which has been dilated, then they need a perineoplasty. So there are many things. And overall, the pigmentation that happens in that area, all because of the hormones, can also be taken care by doing different types of chemical peels, different types of lasers. So if you have anything regarding doubts of your genital rejuvenation, please call us at ZeroSize, Viman Nagar, Pune.